Welcome everyone to the Aerobic Endurance and Anaerobic Training in the Water segment. Yes, that's a very long title, but hopefully by the end of this segment you will have a better understanding of how to train patients in the water. I am Hunter, and co-presenting with me are Austin and Mitch. We are developing this module as part of our doctoral project with our professor, Dr. Bess Maxwell. The goal of our doctoral project is to distribute this lecture to other physical therapy students who do not have an in-depth aquatic component to their physical therapy curriculum. We want to give a shout out to our school, Murphy Deming, located in Fishersville, Virginia, in the heart of the Shenandoah Valley. Just so you have a face to the voices you're hearing, in this picture on the left of us in the pool, we have Mitch on the far left, Austin in the middle, and me, Hunter, on the right. And in the picture on the right, you have a picture of us from one of our mini hiking trips as we love to hike the Appalachian Trail in our free time. The next couple of slides are the objectives for the course. When you're finished with this segment, please go back and read over them so that you can assure yourself that you have completed these. After completing the aquatic, aerobic, and anaerobic endurance training module, the student will be able to accurately define cardiopulmonary exercise, correctly identify the components of the FIT VP model, accurately explain how the FIT VP model correlates to aquatic cardiopulmonary exercise prescription, correctly prescribe aquatic exercise for aerobic and anaerobic training. Here are some more objectives. Be able to discuss rationale for the use of aquatic cardiopulmonary exercise over traditional land-based training. Explain how aquatic cardiopulmonary exercise differs from land-based cardiopulmonary exercise. Identify how aquatic therapy affects vital signs and explain how they should change. And some more. Identify contraindications and precautions for participating in aquatic cardiopulmonary exercise. Identify at least 3 cardiopulmonary exercises in the water. And last but not least, describe how immersion in water affects patients with congestive heart failure.
Hey guys, Austin here. So before we start, we want to make sure that you have a basic understanding of aerobic and anaerobic fitness, and also how to prescribe exercise. This is going to provide us with the information we need in order to prescribe aquatic cardiopulmonary exercise. So let's get started. So what is aerobic and anaerobic fitness or endurance? This was taken from the Therapeutic Exercise book by Kisner-Colby. The definition of aerobic fitness or endurance is the ability to perform moderate intensity, repetitive total body movements over an extended period of time, like walking, jogging, cycling, and swimming. So after a period of time in training of aerobic exercise, you will see physiological changes in the cardiovascular and respiratory system. These changes include decreased resting pulse rate, decrease in blood pressure, increase in blood volume and hemoglobin, larger lung volumes, and larger diffusion capacities. During exercise, these adaptations will occur. Increased stroke volume, increased cardiac output, increased oxygen uptake by the working muscles, and decreased blood flow per kilogram of the working muscle. Your body's demand increases because of the work you're performing, and therefore your heart and lungs have to work more to get the oxygen each working muscle needs. What's anaerobic fitness? So basically, the body is doing so much work so fast that it cannot keep up with the oxygen demand. For example, this would be doing your high-intensity interval training or HIIT workouts or circuit-type exercise routines. This definition, also pulled from Kisner-Colby, reads, short-lasting, high-intensity activity where your body's demand for oxygen exceeds the oxygen supply available. With anaerobic exercise, cardiac adaptations include increased cardiac output, increased stroke volume, increased heart rate, and increased blood flow to active muscles. Neuromuscular and muscular adaptations include increased motor unit recruitment, reduced mitochondrial density, increased buffering capacity of lactic acid, and muscle fiber hypertrophy.
Hey guys and gals, it's Hunter again. So here's a slide that talks about 2 of the more common ways to predict an individualized target heart rate for each patient when exercising. This is here for you as a review and reference slide. If you're not familiar with these 2 heart rate calculations, refer back to a text such as the ACSM guidelines. So how do I know which one to use? Simply put, if you need a quick and dirty estimation on the fly, use the age predicted estimation. However, realize that this method is less accurate. The heart rate reserve method is more accurate and should be used to predict a more precise training intensity. And let's all be honest, we can take 30 seconds to do the heart rate reserve method. In the next slide, we will work through an example so you can see the difference between the two methods and the result. In the age predicted estimation, we start with 220 minus someone aged 35, and we get a max heart rate of 185. Take the max heart rate, which was 185, and multiply it by the intensity that we want them to work at. Obviously, that will depend on the person, but for this case, let's use an exercise intensity of 60% of their max heart rate. This comes out to be 111 beats per minute, which is their target heart rate that we want them to maintain during exercise. Now, with the heart rate reserve method, we have that same person with a resting heart rate of 70, start again with 220 minus the age of 35 to get a max heart rate of 185. Take the max heart rate and subtract the resting heart rate to get heart rate reserve, which is 115. Multiply the heart rate reserve by the exercise intensity we want to work at, which is 60%, to get 69. Add together the training heart rate number and the resting heart rate to get the target exercise heart rate. So 69 plus 70 equals 139 beats per minute. Keep in mind that the key here is that this target heart rate is maintained during exercise rather than working up to or peaking to that point. We want them to maintain this target heart rate for a sustained amount of time in order to improve their cardiovascular endurance. I also want to point out the variance between the two estimations. There's quite a large difference between 111 and 139 beats per minute. Not to say that the 111 beats per minute would not push someone, but it is not pushing them at the estimated level that we want them at, which was 60% in this case. Point being in all of this, here are two methods that we can be used to calculate target heart rate. You decide which one you want to use in your practice.
Alright guys, this is Mitch taking over. So now we're going to talk about RPE. More specifically, it's called the Borg RPE scale. Remember that RPE stands for rate of perceived exertion and not rapid pulmonary edema. That can get confusing. Now, there are a couple of scales such as the 6 to 20 or 1 to 10. But why is RPE used? Well, it's a commonly used method to determine exercise intensity with patients. Anyone can use this, and it's extremely useful with patients who have comorbidities or are taking medications that can cause unpredictable heart rates. Also, this is a great subjective measure, which can be used to tell the amount of work your patient is doing. As I will discuss later, heart rate may not always be an accurate predictor of intensity in the water, so we can use the RPE scale as a great alternative. So, have you ever heard about the FitVP? Well, maybe in your undergrad days you heard about this in your exercise prescription class, or maybe you personally use this method as a way to keep track of your progress. Well, FitVP is a very universal method for prescribing exercise. It's great for documentation and is really easy for patients to understand. This is a simple way for you to start prescribing exercise. So obviously, it's an acronym. So let's go through each of these categories and describe what they are. So frequency is how often. Intensity is how hard. Time is the duration or how long. Type is the mode of exercise or training. For example, this could be like running, swimming, etc. The volume. In endurance training, this is often expressed as minutes per week or MET minutes per week. And then the progression is how to move forward. Remember that progression can also be used to go backwards depending on your patient's needs. So next we're going to talk about PI FPQ. What is it? Well, this is a little acronym that we came up with. PI stands for performance indicators, and the three indicators are fatigue, pain, and quality. This is the way that physical therapists should monitor their patients, both on land and in the water. Observing these indicators will show the patient's response to training. For example, if a patient is asked to perform 2 sets of 8 reps at a given intensity, and they can't complete the second set due to pain or a decrease in quality of motion, then you might want to terminate the exercise or modify it depending.
Thank you, Mitch, for explaining to us FitVP. Let's apply this method. A quick example of this would be a 45-year-old recovering from knee surgery and is deconditioning and wants to work in the water. Remember that your ACSM guidelines is a great resource for prescribing exercise, even based on specific populations. According to the ACSM guidelines, the recommended amount of aerobic exercise per week is a total of 150 minutes of moderate intensity. Since our patient is getting back to fitness, we want him to decrease that volume so that he starts to get used to the amount of work. So frequency, we want him exercising in the pool 3 times a week with an intensity at 60% of his max heart rate or an RPE of 5 or 6 out of 10, and 45 minutes for each of those days he exercises. This will equal about 135 minutes for the week of aerobic training. For type, you can be more specific and say water walking or swimming. Just remember to be specific with your documentation. Also, remember it is based on the patient. So if your patient doesn't have the time to exercise for that long, 3 days out of the week, just spread the workout over more days. The goal here is to just get them up, moving, and reaching a good heart rate.
Okay, here is another example for anaerobic exercise. This might be an athlete or a well-conditioned patient that we want to prepare for return to sport or intensive activity. The biggest thing to keep in mind with anaerobic exercise is the high intensity, short duration of the exercises. As we previously mentioned, this typically includes HIIT training, sprints, high intensity circuits, and powerlifting. Anaerobic training should generally be performed about 3 times a week. For intensity, we're talking about maximal effort for short bursts. This will be an RPE of 8 out of 10 or above. The most current literature and resources recommend 15 to 30 second intervals, followed by a 1 to 2 minute rest break. Training sessions usually range from 15 to 30 minutes in length. We are looking to reach around 60 to 90 minutes of anaerobic training time per week. Then we can progress these patients by increasing the duration of the intervals or by decreasing the time of the rest breaks. Additionally, we can increase the total time of the session itself. By the way, recent studies are indicating that a higher intensity interval training is effective for patients in cardio and pulmonary rehabilitation, so it's good for everyone, not just high intensity athletes.
So why use the water? So patients may prefer the water over exercise on land. Also, water resistance can challenge the very deconditioned or the very well-conditioned. Consider swimming 100 meters. This can be performed slowly and be aerobic, or can be performed in less than a minute and be an anaerobic challenge. Some patients struggle to walk or exercise on land because of weakness or pain. In the water, these patients are more buoyant and able to perform cardiovascular endurance and anaerobic exercise with more comfort. Also, injured athletes who are unable to train on land will decondition. So aquatic PT offers an environment for endurance or anaerobic training to help maintain conditioning while recovering from an injury. Aquatic PT can provide an environment to prevent cardiopulmonary deconditioning following an illness or injury. And also, for the very compromised patient with cardiopulmonary problems, just standing in chest-deep water can provide resistance to strengthen breathing muscles and can improve cardiac output. So this list is not all-inclusive, but these are some great reasons for choosing aquatic therapy. We want to point out, for patients with multiple comorbidities, endurance training can be difficult on land, but they can benefit from endurance training in the water. So these patients might include those with osteoarthritis of spine and lower extremities, those with shoulder impairments, diabetic neuropathy, cardiovascular disease, balance impairments, lymphedema, or other neurological impairments.
As I'm sure you know, heart rate is an often used method for prescribing and monitoring exercise intensity. However, were you aware that there are several factors that affect heart rate response in the water? Well, if you didn't, that's fine, and you will be by the end of the slide. So both the temperature of the water and the depth of immersion can affect someone's heart rate response in the water. So for cold water, between 64 and 77 degrees Fahrenheit, there is a lower heart rate at a given oxygen consumption. In thermal neutral water, between 86 and 95 degrees Fahrenheit, the heart rate response is similar to that of on land. And in hot water, 104 degrees Fahrenheit and higher, there is a heart rate increase at a given O2 consumption. Now, with depth of immersion, you get this effect of increased hydrostatic pressure. So the heart rate tends to be 10 to 15 beats per minute lower in chest-deep water at a given O2 consumption. So, given these differences, it may be useful to use another method to measure exercise intensity in the water. One possible method is to perform exercise testing on land to determine the relationship between heart rate response and RPE. Get them to their heart rate range for aerobic conditioning and determine the RPE at that point. Then, once in the pool, have them exercise at that RPE level. Remember that as an individual becomes more conditioned, their heart rate response to exercise will change. So it's important to periodically retest your patients to make sure you associate their RPE and are keeping them in the aerobic range. So blood pressure can also be affected by an aquatic environment. Mainly, blood pressure response in deep water and water depends on the temperature. So cold water between 64 and 77 degrees Fahrenheit causes vasoconstriction, which leads to an increase in blood pressure. Thermoneutral water causes a blood pressure response that is similar to on land with activity. And in hot water, we get a general vasodilation response, which leads to decreased blood pressure. So think about this when working with patients with unstable blood pressure, because this will be an important vital to monitor in the water as well. So this is just a photo demonstrating that you can take blood pressure and heart rate poolside. Remember that there can be a difference in these two measurements.
How can you measure intensity in the water? Some of these things can get pretty expensive, such as using the PolarTech, which are waterproof heart rate monitors that give real-time heart rate. But for those of you that are not so tech savvy like myself, you can use RPE or heart rate by palpating the pulses or taking a manual blood pressure. The biggest thing is your patient's presentation and what symptoms they might be experiencing while exercising. Remember, pi FPQ.
As with all interventions in physical therapy treatment, there are precautions and contraindications to be aware of before beginning an aquatic therapy program with patients. So, precautions include a fear of water, neurologic conditions such as spinal cord injury and multiple sclerosis. Remember that patients with multiple sclerosis are likely to experience heat intolerance, which can lead to fatigue and discomfort. Respiratory conditions. Remember that the lung expansion is somewhat limited in the water due to hydrostatic pressure pressing against the chest wall. This may lead to worsening of the patient's symptoms. Additional precautions include patients with stable angina, chronic hypertension, and heart disease should be monitored closely as well. Moving on to contraindications. Remember that these are conditions that absolutely disqualify a patient from getting in the water for therapy. Contraindications include unstable angina, uncontrolled heart failure, severe peripheral vascular disease, severe kidney disease, open wounds and skin infections, uncontrolled bowel or bladder, uncontrolled seizures, and danger of bleeding or hemorrhage. Finally, with all patients, pain, fatigue, and quality of motions are determinants for terminating exercise. Remember pi FPQ.
Here are some examples of what types of exercises you can do in the water for aerobic activity. We will show some videos in the next coming slides, that way you see what specifically we were talking about. Most of these are self-explanatory, but remember to be creative when you're thinking about other exercises. If you're getting the patient's heart rate up and they are moving, then you're doing your job and challenging their cardiopulmonary system. So what do you think of this picture? Do you think this is aerobic exercise? Well, it's not. Sorry, Mitch. Good try. Take note in this video, you usually use a flotation device to keep you upright for water jogging. You'll be able to see that in this video. We had this person stay still and jog in place, working against the resistance of the water.
Also remember that even just swimming will be a great aerobic exercise for patients, although maybe not quite like this. Step-ups are another great exercise for the lower extremities. Just as on land, assure proper alignment of the hips, knees, and toes.
Take note of the staggered stance. This is to help with balance and counteracting the force of pushing on the water. Takeaway point here is that any aquatic exercise can be used to target aerobic training. It just depends on the intensity and duration of the exercise. So watch Mitch do these punches in this staggered stance.
Don't forget that the arms can also be used for aerobic training. It is not about the resistance of pushing against the water, but more so about the constant rate of exercise. You can go faster to make it more challenging for patients to get their heart rate up. Treading water is also a great form of aerobic exercise. Just remember that your patient's safety is your top priority. You can use pool noodles or other flotation devices to make treading easier. Water walking is a great exercise for your lower level patients or patients that may be timid in the water but still need that cardiovascular fitness. For anaerobic training in the water, remember that you are pushing the patient at a higher intensity for short periods of time. If you're using RPE as an indicator for intensity, the patient's RPE would be an 8 out of 10 or above. The key here is high intensity. This type of training would be useful for a well-conditioned athlete, but it could also be useful for a patient who is deconditioned. This list is obviously not all-inclusive, just a few examples. Remember, be creative and get their body moving in the water. The resistance from the water will make them work even harder.
Here's one quick example of anaerobic exercise. As you can see, he's doing resistive running in the water.
Go for it. Some key things to remember about pool safety. Always be aware of slippery surfaces, especially when treating patients with balance impairments. Be mindful that patients may be fearful of the water and may take some time to adjust accordingly. Also, be aware of jumpers. And lastly, here's Mitch giving us some advice.
Remember, kids, no more playing. Okay, guys, that was just a joke. Please don't actually do that. Alright, so we're moving on to our first case study. This is a patient who was referred to PT 4 months post-heart attack and now has mild congestive heart failure. She also had moderate osteoarthritis in both knees and her lumbar spine. She was uncomfortable walking or biking on land and said that she wanted PT in the pool to rebuild her stamina without taxing her joints. So pause the video and take a moment to think about some of the things you could do with this patient in the water to improve her aerobic endurance. Also think about the aquatic environment and how that might affect someone with congestive heart failure. Okay, and we're back. Well, interestingly, in a study by Sider et al., they took patients with congestive heart failure and conducted an echocardiography on land and in a warm water pool. What they found was that the immersion in the warm water led to an increase in stroke volume and ejection fraction. These beneficial cardiac effects may improve the exercise tolerance of these patients in the water. So thinking back to our FIT-VP model, we would want this patient to be working at an RPE of around 5 out of 10 for 30 minutes a day, 3 times a week. As she progresses, we could increase the duration and intensity of these exercises as tolerated. We could also use short intervals of higher intensity and push her to an RPE of 7 for around a minute. Remember, we can assess how well a patient is tolerating exercise by looking at vitals, as well as pain, fatigue, and quality of motion.
Our second case study is about a high-intensity athlete who played Division III soccer. He just recently had ACL reconstruction a few months ago and is transitioning into more functional activities to get back to sport. He also has past medical history of left ACL repair. So take a few minutes, pause the slides, and brainstorm on how we can use the water to benefit this athlete. Keep in mind we want to maintain a high MET level, so be thinking, what exercises could we do?
We want to point out that in this case, we tried running on a treadmill on land, but the impact was too much for him to handle. We were able to place him in the pool where we had an underwater treadmill, thus lessening the impact from the ground of each stride. Obviously, not every facility is going to have access to this type of equipment, so you might have to get creative. We also used circuit training and plyometrics in the water, consisting of exercises such as jumping, split squats, treading water, swimming, slide board, and step-ups. Be creative with exercises. Once again, our goal was to sustain an RPE of 6 out of 7 or 6 to 7 out of 10 for 30 minutes. If we do circuit training that involves high intensity exercises, we will meet that goal. Anything you do on land can in some way be transitioned to the water. You just have to think outside the box. We just want to stress the point that if a certain activity is too much on land, get creative and try it in the water. The sky is the limit, or in this case, the bottom of the pool. Side note, this case study is actually Austin. We hope that you liked the picture of him in the last slide as his hair is blowing in the wind. Well, we hope that you guys learned a lot from this presentation. Before we end, we want to close with some final thoughts. Biggest takeaways from this lecture are, don't forget about the water. Aquatics can be a great form of therapy for patients. Remember to monitor your patient's presentation and vitals in the water, especially first-timers and those with comorbidities. Use RPE as it's a great measure of exercise intensity, especially in the water. Remember to use pi-FBQ as indicators for termination of exercise. Be aware of surroundings and keep patients safe, especially the jumpers. And last but not least, motion is lotion. Get patients moving. If nothing else, get them walking in the water. We want to give a shout out to several of our classmates that helped with this video. Thank you guys for putting up with us. Hope you learned a little something. Oh, and one last thing. Always remember, you change the world one life at a time.